be your first surgery? He removed his gloves. You're doing it. My first cut on the tonsil was bleeding less. When I went at my evening around 6 o'clock, the child was up and eating his first cup of ice cream. I till date remember my first surgery day that I did, and it was actually during my first year residency where I had just finished my first term. As usual, it was a Tuesday. I had my surgical round. I hit the wards at 6:45, putting in the patient list, putting their pre-op status, what was there present. For that day, I remember we had 3 children scheduled for tonsillectomy. One adult patient was scheduled for a tympanoplasty and one woman was scheduled for a laryngoscopy. So I took these patients on the list, listed them for the what OTs they are going to be present, their instructions written. I directed the sister to take them to the operation theatres. We had 3 different OTs. One was exclusively for ear surgeries and I scheduled them. They were sitting, the consent and all were taken. In meantime, I think this took me about 15-20 minutes and Sadanand suddenly walked in the OT. Sadanand was the OT in charge during that time. Not a very senior person, but still he was quite knowledgeable in spite of having just cleared his 6th standard. So he just walked in, chala chala madam, tray check kara. So it was, whoever was the resident there was always scheduled to check the trays so that the person can learn the instruments, how they were autoclaved and sterilized and taken in. He again made me go through the entire list of the tray. What were the uses? In fact, he made me say them. One by one, the residents started walking in, especially my senior who was a second year resident. After about 15 minutes, my postgraduate teacher, sir, walked in. And we already had a patient on the table who was a 6-year-old boy, and he had history of recurrent throat infections. His tonsillar size was 4+. He couldn't breathe, he had open mouth and all for breathing and all. And the anesthetist was already on the table. Sir checked the sheet and I was just waiting near the table at the foot side. And the anesthetist, he just ordered the anesthetist, okay, you can anesthetize the patient. I just went with the sir and I helped sir to get his scrub and all. And he just told me, Shwetal, wash up. So I said, maybe he wants me to assist him to show him something. When I approached the table with sir, okay Shwetal, this is going to be your first surgery. He removed his gloves, you're doing it. And my senior was standing next to me. In fact, he was though 6 months senior to me, he was never given a chance. So we both were staring at each other and he was wondering. Then sir said, no Shwetal, I'm telling you, come on and you're going to take the scalpel. And I just didn't know what. So sir said, okay, come on. Sir actually held my hand. He made me pick up the scalpel and this is how you're going to do it. He took my hand and put it on the tonsillar fossa 2 incised and he just removed his hand. He was standing there just looking, whatever you have seen in this 6 months, just see what I do, you are doing it. And just go ahead, you can do it. In spite of being my first surgery, no doubt I was blessed with an excellent teacher. My first cut on the tonsil was bleeding less. It went on so smoothly that he had not even touched my hand to further support me and guide me. He was just watching me. At the time when the tonsillar fossa mein se I removed the tonsils, a bleeder was there. He actually that time showed me how he is going to either coagulate or put a ligature. And he closed me there. He says, you are doing fine, just carry on. At this time, sir was little talking to the anesthetist when I remember that Sadanand came ahead. And he told me, Madam, cotton gauze count nahi kele tumhe. In the fossa of tonsils, which as doctors and surgeons we know, there are always cotton cloths put in. But when the bleeding starts, you don't know whether it's a cloth or a cotton that is left behind. So the trick to this was always the cotton swabs were tied with a thread, and the threads are supposed to be kept at the angle of the mouth. So whenever you are saying a closure to the anesthetist so that he withdraws the anesthetic gases, you start counting how much you have withdrawn. And especially those countings have to be done loudly. So your first assistant knows that he has put 7 gauzes, your 7 gauzes have to come out for a clear surgery. Throughout surgery, there was so much of tension in my muscles that I was actually stiff and sturdy. Though hand was very steady, but there was nothing else I could see. It was only the oral cavity, 2 tonsils, and whatever the instruments that were happening and being given to me. That is where the anesthetist came to tell me that now, since the withdrawal is happening, you need to see that the patient's chest cavity is moving or a cuff reflex is indicated, so that you know in your private practice how it changes the things and how single-handedly you are going to maneuver this entire task. That day when I actually thanked sir and I came out, it was euphoric for me that I have done my first surgery. It was eventless. The 6-year-old boy came out very smoothly out of anesthesia. When I went for my evening rounds, I again checked the kid at 1 o'clock before my evening rounds. The kid was fine. He was responding very well. So he's totally out of anesthesia. When I went at my evening round 6 o'clock, the child was up and eating his first cup of ice cream. After a tonsillectomy, an ice cream is a must so that the child starts the swallowing and there's no more bleeding and all. So I could not curtail my enthusiasm nor my happiness. It was the feeling that it's a milestone crossed. It was a feeling that achievement, that no, I can do this, was so great that it gave me a fantastic relief, happiness. The stress was out completely, and I just till date cannot forget that day of my life. I think most of us always remember our first times to whatever such exhilarating experiences that we have, but somehow that confidence and challenge being that I am a surgeon now actually took me through the rest of my residency days very smoothly. Thank you so much.